Let's do it. And good evening, each and every one of you that have tuned in this evening. This is the Ask Dr. MJ, Your Health is Important, Facebook Live, Instagram Live, YouTube Live broadcast. This is an opportunity for you to call in, tune in, and ask your healthcare questions. This is an interactive forum. Our objective is to give you infotainment, inform you, and entertain you with your healthcare information. The only thing I ask is that you share the information. Okay, we want you to share the information when you have gatherings. If a lot of people are having family reunions, I'm having mine this Saturday, this whole weekend actually, starting Thursday night, my family reunion. So when you are gathering with your family, that is the best opportunity for you to talk about disease states, things that seem to happen in your family, who's diabetic, who has high blood pressure, who has cholesterol issues, who has had a heart attack or a stroke, who has had cancer, what type of cancer, what was the origin, not just, oh, grandmama had cancer and it was all over her body. Well, yeah, by the time it got to stage 4, but what was the origin? Was it breast? Was it colon? Was it pancreatic? We need to know those things and have those discussions. And then if you find out, for instance, that colon cancer is very prevalent in your family, then you need to have a colonoscopy. And so these are disease states that you need to see because you all have the same genetic building blocks that can predispose you or make you susceptible to various disease states. So popular disease state that I talked about last Wednesday, not this morning, but last Wednesday on the Your Health is Important radio broadcast, we talked about on Wellness Wednesday on the Rickey Smiley Morning Show, talked about, the question came up about prostate health. And we talked about what are the things that you can do to optimize prostate health. And again, things that have lycopene in them, tomatoes, tomato-based products are very good for prostate health. There are multiple products. There's one that Reverend Al Sharpton talks about that is very good and one that I highly recommend. Of course, my vitamin D at the 5,000 international unit per day dose. It's amazing how many times I had that discussion today about vitamin D. People that taking inappropriate doses or taking 1,000 milligrams or 2,000 milligrams, or rather 1,000 or 2,000 international units of the prescribed product, and not an appropriate dose, not an effective dose. And so things that you can, omega-3 fish oils, and if you are allergic to fish, other omega oil products that you can take that are very good to help and optimize your prostate health. But the most important thing that you can do, gentlemen and ladies, the best thing you can do for prostate health is frequent ejaculation. So think about this. The prostate gland is like a sponge. So I want each and every one of you to visualize you're washing dishes or you're washing off your kitchen countertop. You have a brand new sponge. You take it out of the cellophane, it's this thin. You open it up and you start wiping off that wet countertop. And the sponge goes and it swells up. And then eventually you keep wiping and wiping. It won't take any more water in. So what do you have to do? You have to take that sponge and go like that. And then you empty it, it shrinks down. You can wipe more. You wipe the counter and get more water off. Well, the prostate gland is exactly like that. The prostate gland makes and manufactures prostatic fluid on a continuing basis. The purpose of that fluid is to provide sperm cells, which are made by the testicles, something to swim in. It gives them an environment that they can swim in when a man ejaculates. Now, understand this. That component of it, the prostatic fluid, also protects sperm cells from the angry and unfriendly environment of a female's vagina. A woman's vagina considers sperm cells as foreign bodies, and antibodies will start to attack sperm cells immediately upon detection. That's why a lot of people suffer from infertility. Now, once the sperm cells have negotiated the vagina and entered the uterus, where conception, where eggs are fertilized, inside the uterus and outside the fallopian tubes, then the fallopian tubes will bring the egg back inside the uterus, and then a pregnancy will happen. Well, that unfriendly environment is mediated by the prostatic fluid, and with that prostatic fluid, you have a continuous manufacture. So if that prostatic fluid is not removed, it's like a sponge that swells up, and now it can't take any more fluid in there. So what happens? The prostate itself now starts to get bigger and bigger and bigger. When a man ejaculates, there's a muscular capsule around the prostate that literally does that to it and does it violently. And when you're a young man, you see when a young man ejaculates, it doesn't just dribble out, it skeets out and go across the room. It's violent. Now, when an older gentleman who's more seasoned does that, it comes out, but with not as much enthusiasm. I laugh and say, you know, what used to go across the room now dribbles at your feet, but you're lucky if it just dribbles at your feet and you can get it out of there. So the point then being that manufactured prostatic fluid needs to be removed. If it is not, it's sitting inside an environment that's 98.6 degrees. It's the perfect oven. It's the perfect environment. This is sterile, but there's bacteria throughout the urinary tract. And if that bacteria gets to go into a 98.6 degree swimming pool full of sterile prostatic fluid, it will contaminate and ultimately infect the prostate. Now you go from having an enlarged prostate to infection/inflammation of the prostate called prostatitis. Itis means inflammation of, like appendicitis means inflammation of the appendix. Cholecystitis, inflammation of the gallbladder. Pancreatitis, inflammation of the pancreas. So you have prostatitis, inflammation of the prostate, which is literally a curse because now a man is going to be living in misery. Once a man has prostatitis, it's very difficult to cure. You can mediate the symptoms with recurrent antibiotic doses, but it's very difficult to totally alleviate and eradicate. So how do you prevent? You prevent by not allowing that fluid to become stale and stagnant. How do you stop it from becoming stale and stagnant? You remove it by frequent ejaculation. Now, the period of time that's recommended as an absolute minimum is 2 times per week. Now, that doesn't mean Friday and Saturday and you go Monday through Friday, without any sex, without any release. Ideally, you want to spread that apart. But remember, that is the absolute minimum time for frequent ejaculation. You cannot, 2 times per day is not too much. And as most adolescent boys can tell you, 2 times per day is not too much. But again, if you have a willing partner, the partner needs to understand that, gentlemen, you need your medicine. That medicine means ejaculation and release of that prostatic fluid. And so you need to have a partner that's willing to work with you and cooperate with you and have an intimate encounter at least 2 times per week. But again, that's the absolute minimum. In a good relationship where everybody likes everybody and things are going well, you actually ought to go, again, more than that, 3 to 4 times per week. The thing is, when we're young and, and in love, we go, daily. And then as time goes on, you get married, you settle into a relationship, daily becomes 2-3 times a week, then once a week, then okay on Saturday, then okay if I don't ask and you don't tell, we agree to disagree, and we'd rather watch our latest Netflix movie before you know it, everybody's sleeping and it hasn't happened. So to maintain a good, healthy, loving relationship, intimacy is a big part of that. And I recommend wholeheartedly a minimum of 2 times per week intimacy, male and female. And gentlemen, don't just be selfish. If she's kind enough to work with you, then you need to work with her and make sure that she's getting some satisfaction out of those 2 encounters minimum as well. And so you want it to be mutually beneficial. When a woman has an orgasm, it decreases her stress level, it decreases the cortisol hormone, which means decreased belly fat. When you have serotonin coming on board, now that's the happy hormone. So you feel better, you act better, you're more fun to be around. And so all of those things happen when a woman has a satisfying orgasm or more, multiple orgasms. And so your goal should be to satisfy her as you're asking her to satisfy you. Okay, that's what we're talking about today. Now, any other topic, remember, this is your show. You ask your healthcare questions. Holly, let's do a roll call and see who we have on air right now. Sean, Big Time Green, my man, the number one, the first male follower that we had. He's from Monroe, Louisiana. Sean, thank you for joining us. We appreciate you. Glenda Everett, hi, Glenda. Thank you so much. You are a returnee. We appreciate you being here again as well. Sherry Gamble, hi, Sherry from Dallas. I hope that hot weather in Dallas isn't too hard on you. Make sure you stay hydrated. Hi, Mimi Witcher from Atlanta/Tampa. We appreciate you being here as well. Thank you, Mimi. Love you madly. Okay, D Holiday 1. David Holiday from Columbia, South Carolina. David, thank you for joining us this evening. South Kakalaki. Okay, hi, Miss Makiva Boland. So good to have you here. Love that new screen that you got right there. And good evening to you as well. Jeanette Stewart. Good evening, Jeanette. Thank you very much. I'm so glad to have you here as well. We appreciate you. Don't you need to tell us where you're from. Cherie Childcare, tell us where you're from, Cherie, as well. We're glad to have you. Lavonda Harris, thank you. You're from YouTube, I know, but where are you calling from? We want to know. Penny Roberts from Henderson, Texas. Penny's got the idea. We want to know where you're from, where you're tuning in from. Devin Brooks from Toledo, Ohio. Okay, we got the Midwest in the house right now. Expecting big things from Ohio State college football-wise this year. Felicia Echoes from St. Louis. Love St. Louis, one of my favorite cities. Got good friends there. We appreciate that. Okay. Velma Austin from South Carolina. Thank you, Velma Clinton, South Carolina. Wait a minute. Velma from Clinton, South Carolina, I guess. Jennifer Monroe McKee from Jackson, Mississippi. Hi, Jackson. We appreciate you being here, Miss Jennifer. Deborah O'Tall Price. Good night from Florida. Well, good evening from Florida. It's not dark there yet. Jeanette, there you go, Jeanette, from Birmingham, Alabama. We're so glad to have you here in the house. Dezonia K from Fort Lauderdale, Florida. Thank you. We appreciate that. TLM from Birmingham, Alabama. We appreciate that as well. Stephanie Alpha, good evening from Columbus, Georgia. Hi, Stephanie. We appreciate you. Sherry Childcare, Ohio. Okay, now we know. We appreciate you, Midwest as well. Lavonda Harris, Birmingham, Alabama. Thanks again. Taddy of Cincy, Lady T from Cincinnati, Ohio. Okay, Ohio is well represented tonight. Michelle Ballard from Baltimore. Hi, Michelle. Thank you. Pitt resident, Chrissy Dumas from Ann Arbor, Michigan. Ann Arbor. Okay, we appreciate that. David Brown from Baltimore, Michigan. Ohio. Everybody's in the house. Maria Robinson coming back south from Florida. Thank you, Maria. We appreciate you. Thank you. So thank you. April Gully from Birmingham, Alabama. Hi, April. Great picture. You and your mom. I really appreciate that. Nikki B from West Palm Beach, Florida. Nikki, I need to come to West Palm. One of my favorite cities. I love the beaches there. That is a great city. Just expensive. Nicole Anthony Shavers from Birmingham, Alabama. Thank you, Nicole. We appreciate you tuning in. Patty, why not? Pat Wilson from Houston. Okay, Houston's in the house. Texas is covered now. Annie Doomerville from Pembroke Pines, Florida. Hi, Annie. Thank you so much, Annie. I like that picture. Olivia Robinson from Cleveland, Ohio. Cleveland, we appreciate you for being here as well. Thank you so much. Okay, let's get right to the questions right now. We got a live audience, and we want to know what your healthcare questions are. Okay, Denise, can symptoms for menopause estrogen loss be similar to rheumatoid arthritis symptoms? Yes, because when you start to get decreased estrogen, you start to get increased inflammation. So that inflammatory condition, particularly if you're overweight, can cause inflammatory kinase to infect and invade each joint of your body. The most common are the weight-bearing joints, of course, which are the ankles, the knees, and the hips. But it doesn't have to be those. It can literally be any joint in your body. That inflammatory process can cause pain, discomfort, swelling, all the symptoms of arthritis. Remember, arthritis just means inflammation of the joint. Rheumatoid arthritis is a particular type of arthritis. The most common is osteoarthritis, and then there's gouty arthritis or gout. So a clear diagnosis needs to be made as to what type of arthritis it is, if it's either of those, or if it's just arthritis as an inflammatory symptom affecting joints. And that way, one, what do you treat it with? One, the body's natural anti-inflammatory, vitamin D, of course. Get the doctor's D formulation at a therapeutic dose of 5,000 international units per day. One of the biggest problems that I find now is a lot of people have been turned on to vitamin D. They've heard me talk about it. They've seen it in other resources. They know that when the coronavirus first came out and there was no other therapeutic options, vitamin D was one of them that you could get. But everybody's taking a sub-therapeutic dose. The FDA only recommends 600 to 800 per day. Most people are getting 1,000 milligrams or 1,000 international units is the unit of measure. 1,000 IUs, which is the most common available on the shelf, and people were getting that. That is a sub-therapeutic dose that does minimal, if anything, because we are so vitamin D deficient. So you get 2,000 minimum, 4,000 to 5,000. My product is 5,000. The doctor's D Available on the website, lipodrops.com. Go to the website right now. And anybody tuning in, you always get a special subscriber discount when you go to lipodrops.com. You can get the the Doctor's D, vitamin D at 5,000 per unit, the body's natural anti-inflammatory. Also, omega-3 fish oil, which kind of lubricates and calms down the joints and also is anti-inflammatory in nature. So that's to answer your question, Denise J. We appreciate that. Okay, Ms. Pleasant, what are your thoughts on migraines that occur for 2 weeks or more? What would be a good prevention? Okay, migraine headaches. You have intermittent migraines, you have chronic migraines, you have cluster of migraines that can happen for the last a week or two and then just disappear until the next time it happens, no matter what you do. That is truly a diagnostic dilemma as to why people have migraine headaches or headaches of any type. We really don't know the answer to that question. If anybody tells you they know why people have migraines, they're just guessing. Now, the good thing is we don't have to know why to know how to treat effectively. There are multiple medications in various types of classes now. The first line is anti-inflammatories, which would include non-steroidal anti-inflammatory medications like ibuprofen or Motrin, naproxen sodium, Aleve at prescription strength, naproxen. At the Aleve is 220 milligrams per tablet. The prescription dose is 375 to 500 milligrams per tablet. That's the first line of therapy. Then there are combination products that contain things like butalbital and caffeine. Caffeine is an amazing blocker of migraines, and it just stunts migraines, stops it in its tracks. That's why a lot of people in the South developed the habit of taking a goody powder with a Coca-Cola. They would take the goody powder, pour it in the Coke, and get headache relief because the caffeine in the Coke and the combination of the anti-inflammatory and the goody powder would give them great relief from a migraine. The problem is that people would do that routinely, almost on a daily basis, to prevent getting a migraine, and that's not good for the stomach. So other things you can do: one, making sure that you get a good night's sleep. Sleep deprivation is directly proportional to recurrence of migraine headaches and severity of a migraine headache. If you're not getting 6 to 8 hours of good restful sleep, you need to check that to make sure that you're getting that, because you start to get stress hormones to build up and they trigger migraine headaches and they can create that. Then we have newer medications that can be taken if you have migraines. By definition, severe headache, usually frontal, but can be anywhere. It starts in the neck and move forward. Associated with photophobia, mean light bothers the eyes and makes the headache worse. If you look at bright light, or sometimes you see people wearing sunglasses or even closing their eyes because the light triggers the headache pain. And then nausea and vomiting. And we're talking about projectile vomiting. So that by definition is a criteria that's necessary to have a diagnosis of a migraine headache. A lot of people use the term migraine generically when they're just having a bad headache and they say, I'm having a migraine. And it's not a migraine headache per se. There are different types of headaches. Tension headaches are very common due to stress, and the muscles in your neck tighten up, which move forward and ultimately end up tightening up all of the muscles on your scalp and creating a big problem. The other is cluster headaches. And so you want to make the appropriate diagnosis to make the appropriate intervention. But again, one of the things that Dr. Collier highly recommends, again, is taking the vitamin D to decrease inflammation, omega-3 fish oil. Even my probiotic can do so as well. And Dr. Collier has 2 new products that might give you some benefit as well. The lipo shrooms, our mushroom-based product, is very good for those types of headaches and decreasing dementia. And so it's good for all things head-wise. Something to try. The lipo shrooms, you can try that. Okay. Okay, is there a reason why, regardless of what I do, my belly never goes down? I tried intermittent fasting for 1 month, faithfully nothing. Well, intermittent fasting, the thing is that if you did intermittent fasting for a month, hopefully you lost weight. The problem is you cannot target weight loss. You will lose weight from wherever you have fat. And for most women, it's going to be arms, the upper back, and the thighs and the hips before it gets to the belly. God designed that for a reason. Supposedly, we have excess fat in the abdomen to protect the growing fetus and baby. And that is why when a woman gets pregnant, she gets, in addition to the weight she gains from carrying the pregnancy, she also gets an extra layer of abdominal fat. When you're younger, usually you have the baby and it goes away and improves. But as you have the second baby, third baby, that layer of fat just gets thicker and thicker and more difficult to get rid of. That is the great thing about two of our products. One, the Lipo Drops Max, the maximum strength formulation, which targets and changes your metabolism so that you will lose abdominal fat. The catchphrase is lose the muffin top with Lipo Drops. That will give you great weight loss. But our newest and greatest product now is our Lipo Nights. It does two things. One, it's got 3 fat burners in it. You take this at night, anytime after dinner before you go to bed. Those 3 fat burners will allow fat metabolism for you to lose abdominal fat. You'll lose fat from everywhere, but it will target abdominal fat in particular. But because it also has melatonin in it, which helps you get a good night's sleep. That good night's sleep will allow you to not have cortisol hormones floating around, because if you don't get restful sleep, you can lay there, but you all know the types of sleeps I'm talking about. If you're tossing and turning and just really not feeling rested, when you wake up, you're not getting good restful sleep. Good restful sleep occurs when you're in stage 4 sleep stages where you're dreaming. If you have a good sleep where you're dreaming, you got a good night's rest. If you did not, you got less than adequate sleep. You have cortisol hormones, that stress hormone, which targets the belly directly and causes the disposition of fat, and particularly the bad fat in your abdomen. So we block that hormone response with the Lipo Nights. The belly fat will go down. In your situation, particularly since you've done the intermittent fasting, you just need to add the Lipo Drops Maximum Strength Daytime, taking 1 dropper full sublingually, meaning under your tongue, before each meal, breakfast, lunch, and dinner, so 3 doses per day, and then the Lipo Nights at night. And the next time we talk, a month later, you're going to tell me you've had great success at losing that abdominal fat. Okay, Queen D2, we want to hear from you. Go to liposdrops.com right now. Go to the website, get more information on things that can help you lose that belly fat. Okay, Kevin McClurkin, I'm struggling with my weight, blood pressure, and diagnosed with AFib. Is Lipo Drops safe for me to take? I really want to lose weight. Kevin, you're absolutely correct. The great thing about all our entire Lipo line, there are no stimulants. So if you have a diagnosis of atrial fibrillation, it's not going to aggravate that in any form or fashion. It is also perfectly compatible with any prescription medication that you may have for your blood pressure and for your AFib. And so if you have AFib diagnosis, you are probably on a beta blocker class drug like metoprolol, toprol, carvedilol, or nebivolol, which control the heart rate chemically, and you may be on a blood thinner. If you have bad AFib, you're on a blood thinner to prevent a heart attack or stroke. The good thing is, once again, weight loss helps with all of those things. The Lipo Drops will be excellent for that. You might also benefit from the Lipo Nights as well, but definitely the Lipo Drops. And one of the things that Dr. Collier has rediscovered, for those that have been following me, you know I underwent a 30-pound weight loss journey. I've lost 30 pounds, and it's really done great. Chin fat is gone, back fat, belly's flat now. But one of the things that I have benefited from is taking my probiotic product as well as my Lipo Cleanse product. I take one of each, the probiotic and the Lipo Cleanse, in the morning when I brush my teeth, and at night before I go to bed when I brush my teeth. Those products are for GI health. They change the gut flora and enhance your body's ability to digest foods, but more importantly, they keep your stomach flat by moving the toxins out. So you have large, easy to pass bowel movements. The Lipo Cleanse product is not a laxative. I have to reiterate that. Even though it's called a cleanse, it is not a laxative. It does not give you diarrhea. It does not give you uncontrolled bowel movements that make you have to run to the toilet immediately. It doesn't do that. What it does do, again, it increases or slows down water resorption. So there's more water inside the colon, which allows you, but the fiber content, it will double the size of your stool. And when that happens, you are losing toxins, because when you lose weight, as fat dissolves, a lot of things that were held in the fat, which is usually a lot of toxins that are inside the fat cells and not floating around your body. Your liver will detoxify them, but it needs to be gotten rid of. And so it'll go to your colon, but if it just sits in your colon, it'll be reabsorbed. So that Lipo Cleanse product keeps that colon moving. So again, large, easy pass stools once or twice a day that are totally controlled, but you will just notice you don't have bloating, you don't have belching. It even improves the quality of your breath. So you don't have an acidic breath, you don't have a foul breath. Even at the end of the day, you've had a long day when normally your mouth starts to get a little dragon-like, you'll notice that your breath is fresh. And you're like, wow, this has nothing to do with your dental health. Most people will brush their teeth, and if they have odors, it has nothing to do with their oral health. It's because of the GI tract. The GI tract is one long tube. Your mouth, your esophagus, your stomach, your small intestines, your large intestines, the sigmoid colon, and the rectum. The name changes, but it is literally one long space. And if there's a backup in that area, if there's, you either burp or you pass gas, or you have a flatulence. Either way, you got to get that air out of there. And you can tell from the quality of that air just how toxic it could be sometimes. We've all had foul smelling gas, depending upon what we've eaten and how long it's been since we had a bowel movement. If you're having a bowel movement once or twice a day and you're using the Lycopene product, you clear that up, no problem. Okay, Kevin, great question. Okay, Instagram question, Barbara Suan. I heard the fish oil pills can cause heart attacks. I don't believe it, but is it true? No, it's not true, first off, but fish oil is very good for that. I saw an article about that recently as well. I think that's faulty data. Everybody knows that omega-3 fish oils are good for cardiovascular health. And if you're allergic to fish, there are non-fish-based omega oil products that you can get that are just as effective. So you want to take those. They have so many great benefits. Decrease the incidence of heart attacks, decrease the incidence of strokes. Again, have a positive effect on joint health. It's literally like oil in the joints as well. But some of the other benefits, when you have an inflammatory condition, and that can be high blood pressure, that can be diabetes, that can be high cholesterol, that can just be overweight. If you're more than 15 pounds overweight, that by itself is an inflammatory condition that causes a release of inflammatory cytokines that float around in your body and do a lot of damage. And so everything is on blast, total body wise, when you have an inflammatory condition. That is why inflammation is the baseline cause of so many different disease processes. A lot of autoimmune diseases like lupus are based on that, rheumatoid arthritis, inflammation caused by that. So you want to take anti-inflammatories. So great question, Bob. I'm so glad you brought that up. Again, I do believe that was faulty data and on research, because for that one statement that was made by somebody, not even sure that it was a doctor or a scientist, there's 1,000 other articles that talk about the benefits of omega-3 products and types of oils that can benefit you. So I tell you, don't just listen to Dr. Collier, do your own research. But Dr. Collier does his research. When I come to you with information, it's not just what I think or what I heard. It is based on scientific research. I will do 3-4 hours of research on a nightly basis to get new information for you, to bring you the latest and the greatest, and not just what you find, again, on the internet per se. You have to look for particular things. There's a lot of great scientific information that comes out of China, the United Kingdom, Australia, around the world. People are doing great things in Germany with medicine. You have to be willing to find that data and to see some great information. Sometimes things that are being done over there that don't make it to the United States for years, because our FDA is so strict on allowing new products into the US and new technologies and new things. Sometimes you have a drug that's doing wonderfully for one thing, but they don't use it for another thing that it does wonderfully as well, until they've done research and documented that it's done that. So that may delay the process for a decade. So again, we try to bring you the latest, most current information and accurate information when we talk to you here. And you ask the doctor. You want to ask the doctor and get good information. Okay, great question, Barbara. Okay, Lynn from St. Louis. Is it true that someone on blood thinners should avoid taking krill oil? I heard this one's curious if it was true. Well, blood thinners in particular, if you have a vitamin K component, and some of these oils will have not just vitamin D, but vitamin K as well. Vitamin K can cause delay in clotting. So basically, that means if you're also on a blood thinner, you lose your ability to clot. So the slightest bump or bruise can cause a bleeding. But if you have an injury, that can really create a problem. If you have a stroke where you have a bleed, there are two types of strokes. There's an obstructive stroke where cholesterol plaquing blocks an artery, and so everything below that blockage is not getting blood. Those are where you use clot busters to fix that. The others where a blood vessel literally pops like a balloon, and then you just got blood going all over your head. And if you're on a blood thinner and you don't have the functioning capabilities of platelets, most blood thinners work on platelets proper, but there are other mechanisms for clotting as well. And sometimes you add, if you throw vitamin K in there, it blocks that cascade. So you now have an inability to clot. And so then you have to take something to restore clotting ability. And the objective is that you don't bleed to death while that's happening. So krill oil, again, is a good omega-3 fish oil, but if you're on blood thinners, would not be my first choice. I just stick with omega-3 if I could do that. Fish. Okay, great question. Calvin Flemons, currently taking vitamin C, zinc, turmeric, magnesium, ashwagandha, B12, and maca root powder. In the gym 5 days a week and walk 3 miles a day. I can't get rid of belly fat. Well, part of the reason is none of those things work on belly fat. Those are great, absolutely great supplements, particularly the vitamin C and the zinc. I don't see vitamin D in there, which will give you a better benefit. Magnesium is good. Ashwagandha can decrease appetite somewhat, but again, you're taking supplements that aren't addressing what your need, want, and desire are. Your need, want, desire is belly fat. And I see you in the gym 5 days a week and you walk 3 miles a day. You are a perfect demonstration that you do not lose weight in the gym. Dr. Collier tells you this all the time. A very vigorous workout in the gym of 1 hour, and most people work out less than that, but let's say you have the perfect workout. You work out for an hour. You only burn 800 calories. To lose 1 pound, you have to have a 3,500 calorie deficit. That's why most diets, which is where you do lose weight, you lose weight in the kitchen, not in the gym. You get fit in the gym. You can develop a great muscular definition. You can look healthy and fit, but you're not going to lose a lot of weight, particularly once again, because you're only going to burn 800 calories. And the most common behavior after a vigorous workout is going to eat. And the average caloric intake of a post-workout meal is 1,250 calories. So basically, you're burning 800, you're taking in 1,250 above and beyond what you normally would eat. So you've increased your calorie intake by over 500 calories. And over 7 days a week, that's 3,500 calories. So you may actually gain weight, 1 pound a week. So people say, I've been working out. Not only have I not lost, I'm gaining weight, but it's all muscle. No, it's not all muscle. So that is probably, it may be, 2 to 1 fat to muscle. But when you lose weight, for every 15 pounds you lose 10 pounds of fat, 5 pounds of muscle, unless you're doing some things, protein supplements, etc., so that your muscle loss can be minimized. One of the great things about the lipo product line, particularly the Lipo Drops maximum strength formulation, is that it targets your weight loss so that it's 98, 99% fat only. So worst case scenario, most people on a diet plan will lose 20 to 30 pounds. The problem is once they stop following the diet plan, they'll gain it all back. But if on the standard diet, particularly a calorie restriction diet, you're going to lose, again, for every 15 pounds, 10 pounds of fat, 5 pounds of muscle. But when you gain it back, it's all fat. So let's say you start off at 250 pounds and you lose down to 220. You look great. Now you gain it back. You're 250 again. It's the exact same 250 pounds, but you look totally different. Know why? Because now you have increased your fat content, your basal, your BMI may be the exact same number, but you have more body fat, your percentage of body fat. So now instead of being thick, now you're doughy. So you're fatter. You're at higher risk for a heart attack, high blood pressure, diabetes, all of those things, because even though the number is the same, your starting number was 250, you have shifted your somatotype to one that has more fat. And when you have predominantly fat, you have inflammation and you're going to have those problems. So you need products like our Lipo Drops Maximum Strength. The Lipo Max will work for you. Doing any of those things that you're doing or none of those other things that you're doing. The maca root powder is good for sexual function. So I'd say keep taking that because that's going to make you a real man. But the B12 and all those other supplements, they have great benefit. The vitamin C and the zinc are good for your immune system. The turmeric and magnesium, good for inflammation. Ashwagandha has a lot of great benefits. Again, most people take it because it can decrease your appetite, but you have to monitor what you're eating and decrease your caloric intake when doing so. But if you alter your metabolism, see, there are two methodologies to losing weight. One is decreasing your calorie content. That works 100% of the time. There are 13 different strip mall diets out there, I call them. There's Weight Watchers, Jenny Craig, NutriFit, Nutrisystem, all these things. They all are based on calories, decreasing the amount of calories and the quality of calories that you're taking in. And guess what? They all work, each and every one of them. If you do what they tell you to do, exactly the way they tell you to do it, you will lose weight. The problem is, once again, as soon as you stop doing it, you'll gain weight back. And that's why most people will cycle through multiple versions of the strip mall diets until they come to a product like the Lipo Drops, where we're not decreasing your calorie content. That's not the methodology of the weight loss. The methodology of the weight loss is altering and adjusting your metabolism so that, one, you're not absorbing calories, and two, when you do, you're metabolizing fat very effectively and very efficiently, and that fat is not going to your waist and not going to other parts of your body being deposited. So the Lipo Drops, maximum strength formulation. And we have the maximum strength formulation. Why? Because it's 10 times stronger than the original formulation. The original formulation worked wonderfully. But people, you know how people are. They say, well, if a little works good, then a lot will make me lose more quicker. And so people were taking more than the recommended dose. And guess what? They were losing more weight and more fat, and they were losing it quicker. So we did a research project. We found out that you could increase, and we did so by a factor of 10. So the maximum strength formulation, we found that there was no real additional benefit going beyond 10 times the dosing that we had previously. So 10 times is where we are. That gives you the maximum benefit that will accomplish your objective. So go to the website, lipodrops.com, look at the Lipo Drops maximum strength, and I would consider as well the Lipo Nights. I would add in particular, since you're concentrating on belly fat, the Lipo Cleanse and the probiotics. That we have a belly fix combination. That's the objective is for us to shrink the belly also from the inside and the outside, not just the fat on top of the belly, but also the fat that's inside the belly and things like the gas and the bloating that's inside the belly as well. All right, Calvin, we want you to do that. Get back with us in 1 month and let us know how you have fared, because when people do that and do it correctly, they will have a great benefit. Now, one of the things that has happened sometimes, people get the Lipo Drops product and they squirt it in their tongue and they swallow it. Guess what? Doesn't do anything in your stomach. The way that the Lipo Drops work is sublingually. You put it under your tongue. You hold it under your tongue for 2 minutes or more. Then you swallow it. It's absorbed under your tongue as effectively and as efficiently as if you had gotten an injection of the exact same compounds. But it's absorbed very, very efficiently. But you have to hold it under your tongue for 2 minutes. Then you can swallow it. We used to tell people they could spit it out, but now we've changed the formulation. It tastes much better. So you can swallow it now and not have any problems. But you will find that that's how it works. And if you are doing that appropriately, you will get great benefit. If you're squirting it under your tongue and swallowing it and then drinking some water or something, that's not how it works. You have to follow the instructions because it functions and it works sublingually. If you ever saw someone taking a nitroglycerin tablet, they have chest pain. They take out the little bottle, they put the nitroglycerin under their tongue. Within 15 to 30 seconds, they're pain-free, almost instantly, because that's how efficient absorbing medication sublingually is and giving you relief. So the Lipo Drops formulation that's why it's liquid. That's why it absorbs so effectively and efficiently sublingually or under the tongue. You hold it on there for 2 minutes, you will get that benefit. You do that again a few minutes before each meal. You can literally do it right before you take your first bite. But if you plan and take it maybe 10 to 15 minutes up to 30 minutes before you eat, you will have even better benefit. But people say, well, I'm not sure when I'm going to eat. So I say, well, look, before you take your first bite, you squirt it under your tongue, hold it under your tongue for 2 minutes, then eat, and you will get benefit from this product. It will optimize your fat burning. You will metabolize 90+% of that fat, so it will never become abdominal fat. It will never become peripheral fat, and you will get that sculpted look that you want without doing a single sit-up crunch, without working out with weights, without doing all those things, which you are welcome to do. But remember Dr. Collier's catchphrase: you lose weight in the kitchen, not in the gym. You get fit in the gym. There's benefit to working out. You improve your cardiovascular fitness. You have more wind. You have more muscular strength, but you may not lose a pound. As a matter of fact, you may gain weight while doing so. So you have to coordinate what you're eating. You lose your weight in the kitchen. Next question, Holly. Brad James, the doctor says, I'm going to remove my thyroid. I have neither hyperthyroidism nor hypothyroidism. It's getting uncomfortable and making me cough, difficult to swallow certain foods. How can I shrink it? You can't shrink it. If it's a physical obstruction, then there's no other way to do it. You will have to have it removed. Doesn't mean you have to have the entire thyroid removed. There are ways. Some doctors will. The thyroid one, it's a butterfly-shaped gland that literally is right on your neck. And if you consider the body of the butterfly here and the wings coming out to each side, it comes out about a few centimeters on each side of your neck. Now, they can take out half of it. You can have one side that's perfectly okay, the other side removed. They can take out the top half. They can take out the bottom half. They can take out a quarter of it. If it's so large that you have a goiter situation where you have a physical obstruction, then there's nothing that exists that shrinks that. Once those thyroid globules exist, they have to be surgically excised. Now, if they take out your entire thyroid, you're going to be required to take thyroid supplements every day for the rest of your life, because you won't have any thyroid at all. And you need thyroid hormone. That is your master gland. That is your body's thermostat. It controls your metabolism. It controls your body's heat, how warm you are, how cool you are, how much you perspire. Again, your energy level, your sense of wakefulness. Are you fully alert and functioning? Is your brain going good? Are you foggy brained and, forgetting stuff and stopping mid-sentence because you forgot what you were going to say or do, or losing your train of thought? All of those things are a direct function of thyroid, not to mention, as I talked about this morning on the Rickey Smiley Morning Show on Wellness Wednesday, hair loss. Hair loss. If you have receding hairline, if you have thinning hair, if you have a balding, that is, if it's not genetic, it's thyroid, or it's thyroid disease until proven otherwise. It's thyroid disease, and it can be high thyroid or low thyroid. But if you have your thyroid removed, you're going to have a replacement just to make sure you don't lose hair. So this is going to require a partnership between you, your primary care physician, the endocrinologist, and your surgeon to optimize how this is being addressed, because it sounds as if you have it is physically obstructing. That means you have a mass. And years ago, people used to walk around with thyroid goiters that were the size of a softball, even the size of a football, sitting under the neck. They couldn't close their collar, but it literally pushes on the airway as well as the esophagus, which would impact their ability to swallow and even breathe. So that rarely happens now, because we have medications that can, when we start to see thyroid disease, we got medications for high thyroid and medications for low thyroid. But once you have a mass of thyroid tissue, surgery is the only option that we have right now. Okay, so I wish I could offer you something else, but they're telling you directly and correctly. So you'll have to get with that program. But what you need to clearly understand is what's the plan of action after it has been removed, because that is when the real work will begin. Adjusting your thyroid levels if the entire thyroid is removed. If they only remove a portion of it and leave functioning thyroid tissue, your body will usually readjust and you'll have enough to give you the benefit that you need. It might require some temporary supplementation, but what's there can grow. Your body will adjust to it. It will stimulate. The thyroid stimulating hormone will tell that thyroid tissue to make more thyroid, and you will usually get up to a reasonable level. That just has to be monitored so that you don't go into a hypothyroid condition. Okay, great question. Mildred Roberts, my hair is literally coming out by the curls. My hair is naturally curly. What can I do for this? One, Mildred, you want to check those two things. Again, hair loss can be genetic, and the number one clue would be your mother's father. Did he have a full head of hair? Did he lose his hair? Did he have bald spots, etc.? That is the what you have genetically inherited, that tendency. One. Two, is it if it's not genetic and it's metabolic, then again, hair loss is thyroid disease until proven otherwise. Next on the agenda is anemia. Need to check for iron deficiency, B12 deficiency, anemias as well. And then other things I talked about this morning. Are you putting chemicals in your hair? Are you straightening your hair and or coloring it? All of those have to be, you have to use products that are not harsh on the hair, and then heating, from blow drying to hot combs, all of those things. And, these curling irons that plug in now can do damage to hair. You can pull your hair out. If you have a stressful hairstyle, a pulled back bun or tight braids, or if you're wearing a weave and you have your hair underneath a cap, all of those things are things that have to be evaluated. This is where you want to talk to your hairdresser. Most hairdressers are not just, they don't just cut and color hair. They actually know something about hair health, and they can give you some insight. Your primary care doctor ought to be able to do so as well. And if necessary, you need a dermatologist that specializes in your type of hair, and they can give you some more insight. I even talked about there's a new technology, plasma-rich platelet therapy, where they take your own blood, they centrifuge it, they isolate platelet cells, and then they re-inject them, multiple series of injections along the scalp line, which will stimulate hair growth. And then one of the other things, laser caps. Laser caps are also very effective in stimulating hair growth. So all of these techniques are something that you need to evaluate and start to do. The earlier you do it, the better, because if you have some disease process that is causing scarring on the scalp, once you have scarring, the hair follicle it disappears, it's scarred over, it's dead, it won't function anymore. So you cannot bring that hair back. If you have just hair follicles that aren't working for whatever reason, they can be stimulated and you can get regrowth. So multiple ways to do that. There's not one right way. What's important is the right way for you, Mildred. We want to make sure that your hair is treated appropriately. So check that out. Again, it's going to be a process. You're not going to go to the doctor today and have no problems with your hair tomorrow. It usually takes anywhere from 3 to 6 months before you really start to see benefit, but it can be. And again, in 3 to 6 months, if you don't do anything, you really can have a problem with your hair, particularly if it's coming out by the curls. That can be, there's a caveat too about stress, anxiety, and a variety of other things that can, in emotional status, that can affect your hair. But if that's not the case, and that could be, you need to evaluate all of those things. But work with, again, your hairdresser first. See if they're using anything that could be causing this. And it may be something that you have tolerated for years, your favorite hair color that you buy at the grocery store now, but this is not what you need to be using now, because as you become more seasoned, older, in other words, your hair becomes more fragile, and you have to be very more conscientious about preserving your hair. When you're young, hair comes out all the time, but it's replaced and you never miss it. You'll see it in the comb, but you never miss it. But now you'll see, you start to see, wow, my hair's coming out. It's in the shower. It's in my comb. It's in my brush. I can even take it out with my fingertips. Something's not right with that. It needs to be addressed. Let us know how you do, Mildred. We want to know. Kevin Magruder, what causes a PSA level to rise after prostate surgery? PET scan even revealed negative cancer results. Okay, Kevin, great question. One, the PSA level is made only by functioning prostatic tissue. So that means depending upon the type of prostate surgery that you had. If you had a total prostatectomy, you should have undetectable PSA levels. But there could be prostate tissue that's scattered all over your pelvis. There could be normal prostate tissue, not necessarily cancerous prostate tissue. A PET scan, the purpose of which is to determine whether you have any metastatic cancer, usually in the bones, but it can be in other areas, but the most common areas in the bones. And that's what a PET scan is determining, whether you have any functioning cancer cells that can be detected by the PET scan. So if that's not the case, again, you could have PSA levels, but a normal PSA is less than 4. If you were undetectable at one point after prostate surgery, and now that level is rising, it needs additional evaluation. The PET scan is just one step in that. There are other things that need to be done. They now have MRIs of the prostate. If you had prostate seeds versus surgery, versus a prostatectomy, which is the removal of the entire prostate, there are various surgical techniques that can be employed. So it depends on the type of surgery that you had. So sounds like your urologist is on this. They ordered the PET scan on you. So now they're trying to figure out what it is. So that is indeed the case. It can indicate a recurrence of the prostate cancer. So we want to make sure that that's why they're very careful about doing so. Oftentimes, after surgery, you may need chemotherapy or radiation therapy. External beam radiation therapy is now something that Dr. Collier never recommended in the past, but now the technology has improved, because before they would just bathe your whole pelvis with radiation and it did damage to normal tissue as well as cancerous tissue. Now they can focus those radiation beams so precisely, they call one of the machines the gamma knife. It's gamma radiation, and it can be focused with precision on a millimeter to millimeter basis. So it doesn't do damage, because they'll have radiation coming from this direction, or radiation coming from this direction, or radiation coming from this direction. They may have 1,000 beams of radiation, each one individually, all benign, not causing any problems. But at the focal point where all 1,000 of those beams are focused, it can kill and cure cancer tissues. So again, one of those things that is available for you. This is going to be a process, but it may just require monitoring. But if you went from very low to non-detectable to now all of a sudden your level is above 4, then it's definitely something going on that needs to be evaluated. Great question, Kevin. That's one. Share that information with other people that you know that have prostate cancer or have questions about prostate cancer or prostate issues at all. Dr. Collier has been seeing an increase in this, particularly in African-American men. I would say I have personal friends, at least 6 of them that I can name, diagnosed in the last year. And, fortunately, all of them have had good outcomes because of early detection. One of the things that I do, early initiation of a viable treatment option. And again, to get them on healthy things like the vitamin D. The vitamin D, 5,000 international units per day, is very good in the treatment of prostate cancer. If you're not already taking vitamin D, you need to be taking vitamin D. Again, I would also recommend omega-3 fish oil, but vitamin D, vitamin D, vitamin D. When people get a cancer diagnosis of any type, the first thing that they do is put you on vitamin D. And so you need to be on vitamin D, and I would continue to take it for the duration. I would never not be taking vitamin D because, it's going to prevent other types of cancers as well. Colon cancer, pancreatic cancer, breast cancer for women. Multiple studies from around the world that show the benefits of vitamin D in doing so. And the vast majority of urologists will put you on vitamin D. The problem is a lot of people get it. They start taking it. After they've had their surgery, they stop taking it, thinking they don't need it anymore, or they just become recalcitrant with the therapy. But that's one of the things that you can do that's natural. People always say, what can I do natural, Dr. Collier? I don't want to take medicine. I don't want to do this. Well, the vitamin D is a perfectly natural way. This is not medication. It's just a vitamin. But the benefits, particularly with the cancer diagnosis, are amazing. So vitamin D, 5,000 international units per day is a therapeutic dose. You can go to the website, get the Doctor's D, and do so. It used to be very difficult to find a vitamin D product of 5,000 international units. Again, the standard dose was 1,000. Sometimes if you got lucky, you can find 2,000. They tell you to take 2 or 3 of those. But now 5,000 is readily available, but you want a quality product. What we have on the LipoDrops website is a high quality product that's going to give you the benefits that you like. So Kevin, let us know how you do. We want to know the etiology of this and whether you're going to do, how good you're going to do. Thank you so much. Nikki B, struggling to lose weight. I'm a night nurse at the hospital. I don't eat after 7 p.m. I have changed my diet to low carbs and I'm gaining, not losing weight. Help. Okay. Nikki B, night nursing, one of the worst professions you can have as far as weight gain is concerned. There was a study done that was on nurses. You can Google it. And I think it was predominantly African-American nurses that were working or graduated from school and are working day shift and then went to night shift. And then they monitored them for 6 months, 12 months, 18 months. Now I think they're up to 3 to 5 years. And the weight gain was absolutely incredible. Part of the problem is that the night nursing, it creates a problem with sleep deprivation. So you get an excess of the cortisol hormone, which causes a disposition of fat, particularly in the abdominal area. So when you eat, when you work nights, your body doesn't adjust to that. The world goes on from 9 to 5 every day. And if you're not sleeping at night when everybody else is sleeping, you never get the amount of sleep that you want. You don't get the quality of sleep because there's too much going on. You can't be in a room that's dark enough, quiet enough, because everybody else in the world is calling you, they're bothering you, you're getting, again, you're on social media, all these things that you shouldn't be doing because you should be sleeping. So we want to make sure that, one, you're optimizing your sleep. So we want to make sure that you're getting the best types of sleeps that you can get. quiet room, dark room, and not disturbed for a minimum of 6 hours. And hopefully you'll get 6 consecutive hours. Now, you would be a perfect candidate for the two things that we talked about. The Lipo Drops Maximum Strength formulation, using that with each meal, trying to do it at least 15 minutes before you eat. Hold it under your tongue for 2 minutes, then swallow, then eat. And then the Lipo Nights for whenever you are going to sleep, not just at night, but whenever your bedtime is. You take it before bedtime, and that will target the abdominal fat as well. So a low carb diet can help with losing weight, but if it's not helping you, then what's more important, you probably would benefit more from intermittent fasting. You say you don't eat after 7 p.m., but the question is, what time do you start eating? I would try to eat everything that I'm going to eat that day in 1 8-hour period, say 6 a.m. to 6 p.m. or 7 to 7, or I'm sorry, that's 12 hours. So I would go from, if you don't eat after 7 p.m., I'd try to make it 6 p.m. at the latest that you're eating, and then go ahead. So that would be, say, 10 to 6. Everything that you're going to eat that day, you eat between 10 and 6, and try to be consistent on your off days as well. Intermittent fasting is very effective in weight loss, but if you supplement that with supplements like the Lipo Drops Maximum Strength and or the Lipo Nights, you're going to get additional benefit and great benefit. So also, increase the number of crunchy fruits and vegetables that you have in your diet, the fiber in your diet, so that you're having good, large, easy to pass bowel movements. You can supplement that also with our Lipo Cleanse product, probiotics, which will change the unhealthy gut flora that you have to a healthy blend of gut flora, and help you, digest your food appropriately and maintain it in the ways that you want to. So, Nikki, go to the website, lipodrops.com. It's got a lot of good information on there about, one, what you want to lose, how you want to lose it, and what's the best methodology that works for you to do so. And so it's a great amount of information on there for it, and you can get more information to accomplish your objective, which is to losing weight. We don't want you struggling, but again, if you can get off that night shift, if you're on night shift because of lifestyle, you need to be at home with children during the daytime or whatever, we understand that. But as quickly as it's feasible, get off that night shift, because it's just, everybody at night shift have health challenges that are associated strictly with night shift. They call it night shift syndrome. They got so many different things, but weight gain is the first sign that things are going wrong in your body and that you need to make some changes. Okay, Nikki B, great question. Eat it raw mean. What can I do besides compression garments to get my lymphatic system flowing correctly? Adult compression is good, a part of the strategy. And then appropriately, when you lie down at night, you got to make sure, one, that when you are lying flat, and you need to lie flat on your back, if your legs are swelling, you need to make sure that your legs are, I'm trying to get a prop here that would work. See if you can see this. A straight leg like this will not drain. You put a rolled up towel or a round pillow underneath your knees so that your legs are flexed about 15 to 30 degrees. That relaxes the muscles from your ankles to your hips. That allows your general circulation to move fluid out, and you'll wake up in the morning with smaller legs, ankles, and feet. And doing so, compression socks, the purpose of them is to prevent the swelling from occurring the first time. It will also help if once you have the swelling, but the objective is to close the space that the fluid collects, so that you don't have gravity fighting you and making you have swollen ankles, swollen feet, swollen legs in doing so. So that's part of the process. Monitor your sodium intake. Sodium will cause fluid retention, but oftentimes when people have problems retaining fluids, they decrease their fluid intake, so they're not getting enough fluid. The problem is that if you are drinking more fluid, it will make you literally urinate more, so you would diurese. So you need to increase your fluid intake, and we're talking about water predominantly. Okay, there's no substitute for water. You can't say, well, I don't drink water, I drink coffee, or I drink tea, or I drink soda, or I drink whatever. None of that matters. We're talking about water. 6 to 8 to 10 glasses per day. Particularly if you're not in a controlled environment, you have to deal with this heat, let's say 10, but 8 minimum. 8 glasses of bottles of water per day to help you move that fluid. You will notice that you're moving that fluid. Monitor your sodium intake so that you're not retaining fluid. Salt makes you hold on to fluid. And then if you have any other health challenges like high blood pressure and or diabetes, there are medications specific to that disease state that can help you diurese fluid as well. For diabetes, the SGLT2 inhibitors like Farxiga and Jardiance will help you diurese. For blood pressure, again, the angiotensin receptor blockers with a diuretic will help you diurese. You want to control each and every one of those disease states to help with fluid retention in your body. Okay, this brings to an end this episode of the Ask Dr. MJ, Your Health is Important radio broadcast. We are so glad that you tuned in. Tell all of your friends to tune in on Wednesdays at 6:30 p.m. Eastern Standard Time, and go to the website lipodrops.com, where you'll find information on various healthcare topics and subjects. It links to our YouTube channel, where we have hundreds of videos on a variety of different healthcare topics as well. We'll see you next time. Thank you so much.